Introduction to Heart Bypass Surgery. Heart bypass surgery, medically known as coronary artery bypass grafting, CABG, is a major surgical procedure used to restore normal blood flow to an area of the heart that has been affected by blocked arteries. The coronary arteries supply oxygen-rich blood to the heart muscle, and when they become narrowed or blocked due to plaque buildup, a condition called coronary artery disease, the heart cannot receive enough oxygen. This can lead to chest pain, angina, shortness of breath, fatigue, or even a heart attack. In a bypass surgery, a healthy blood vessel is taken from another part of the body, usually the leg, arm, or chest, and is grafted to the blocked artery, creating a new route for blood to flow. This surgery does not cure the underlying disease, but it can significantly improve quality of life, reduce symptoms, and prolong life expectancy. Doctors typically recommend it when lifestyle changes and medicines are not enough to improve heart health or when angioplasty is not suitable. It is one of the most common and successful heart surgeries performed worldwide, with millions of people benefiting from it each year. Why heart bypass surgery is needed? Heart bypass surgery becomes necessary when the coronary arteries are so narrowed or blocked that the heart muscle is not getting enough blood and oxygen, putting a patient at serious risk of heart failure or a fatal heart attack. The most common cause is atherosclerosis, where fatty deposits, plaque, build up inside the artery walls over time. In many cases, patients try medicines, dietary changes, and exercise first, but if these steps do not work, surgery is considered. Other reasons include severe chest pain, even during rest, narrowing of the left main coronary artery, which supplies most of the heart's blood, or damage to more than one major coronary artery. In some emergency cases, such as a severe heart attack, a bypass surgery may be performed urgently to save the patient's life. Doctors evaluate the severity of the blockages using tests like angiography before recommending surgery. Age, overall health, and the condition of the heart muscle are important factors in deciding whether a patient is fit for this procedure. The goal is to restore normal blood flow to the heart so that it can function properly and the patient can return to a normal or near normal lifestyle. Preparing for the surgery before undergoing heart bypass surgery, patients must go through a detailed preparation process to ensure safety and improve the chances of a successful outcome. First, the doctor will conduct a full medical evaluation, including blood tests, chest X-rays, electrocardiograms, AD, and sometimes echocardiograms to assess heart function. If not already done, a coronary angiogram will be performed to map the exact location and severity of blockages. Patients are usually advised to stop smoking, manage blood sugar levels if diabetic, and adjust any blood-thinning medications. In some cases, patients are admitted to the hospital the day before surgery for observation and final preparation. A clear explanation of the procedure, risks, and expected recovery timeline is given so the patient and family can make informed decisions. Psychological readiness is equally important. The idea of heart surgery can be frightening, so counselling and reassurance help reduce anxiety. Patients are asked to avoid eating or drinking for at least 8-12 hours before surgery. The medical team also ensures that the body parts where veins or arteries will be harvested, such as the leg for the saphenous vein, are examined and prepared. These careful steps make sure the surgery goes smoothly and risks are minimized. The surgical procedure heart bypass surgery is usually performed under general anesthesia, meaning the patient is asleep and does not feel any pain. The procedure starts with the surgeon making an incision down the middle of the chest to access the heart. The breastbone, sternum, is split open to allow a clear view. In many cases, a heart-lung bypass machine is used to take over the function of pumping blood and supplying oxygen while the heart is stopped. The surgeon then removes a healthy blood vessel from the patient's leg, arm, or chest wall. This graft is carefully sewn into place so that it bypasses the blocked section of the coronary artery, creating a new pathway for blood flow. If multiple arteries are blocked, more than one graft may be used. This is called a double, triple, or quadruple bypass, depending on how many arteries are repaired. After the grafts are in place, the heart is restarted, the breastbone is wired back together, and the incision is closed with stitches. The surgery typically lasts 3 to 6 hours, depending on complexity. Advances in surgical techniques, such as off-pump bypass surgery, allow some procedures to be done without stopping the heart, reducing recovery time, risks and complications. Although heart bypass surgery is generally safe and has a high success rate, it is still a major operation with possible risks. Common risks include bleeding, infection at the incision site, irregular heart rhythms, arrhythmias, and reactions to anesthesia. In rare cases, more serious complications can occur, such as stroke, kidney failure, heart attack during or after surgery, or problems with memory and thinking, often temporary. The risk level depends on the patient's age, overall health, presence of other medical conditions such as diabetes or lung disease, and how badly the heart is damaged. Smokers, people who are overweight, and those with poorly controlled blood pressure are at higher risk. Surgeons and the medical team take extensive precautions to minimize these risks, including careful monitoring, sterile techniques, and preventive medications. Most complications are treatable if detected early, and hospitals have trained teams ready to respond quickly. Patients can help reduce risks by following all pre-surgery instructions, maintaining a healthy lifestyle before the operation, and staying active in their recovery program afterward. Despite the risks, the benefits of improved blood flow, reduced chest pain, and a lower risk of future heart attacks often outweigh the potential complications. Recovery in the hospital. After heart bypass surgery, patients are moved to the intensive care unit, ICU, for close monitoring during the first 24 to 48 hours. They are connected to machines that track heart rate, blood pressure, oxygen levels, and other vital signs. A breathing tube placed during surgery is removed once the patient is awake and able to breathe independently. Pain is managed with medication, and fluids or nutrition may be given through an intravenous thigh line until the patient can eat normally. Chest tubes are placed to drain excess fluid from around the heart and lungs, and these are usually removed within a couple of days. Physical therapists may begin gentle breathing and movement exercises early to prevent complications such as pneumonia or blood clots. And most patients spend about 5 to 7 days in the hospital, depending on how quickly they recover. The healthcare team will also teach the patient and family how to care for the surgical wounds, recognize warning signs of infection or complications, and follow the prescribed medication plan. Before discharge, a rehabilitation plan is created to guide the patient's recovery at home. Recovery at home once discharged from the hospital. Recovery continues at home and can take several weeks to months, depending on the patient's overall health. The breastbone typically takes 6 to 8 weeks to heal completely, so activities such as heavy lifting or driving should be avoided during this time. Patients are encouraged to walk daily, gradually increasing distance and pace as stamina improves. Pain, swelling in the legs from vein removal, and fatigue are common in the early weeks but should improve steadily. A follow-up appointment is usually scheduled within 2 weeks to check healing progress and adjust medications if needed. Emotional recovery is also important, as some patients experience mood swings or depression after surgery, and support from family, friends, or a counselor can be valuable. Maintaining a healthy diet, taking prescribed medications on time, and following the rehabilitation plan are essential for long-term success. Patients must also watch for warning signs such as fever, chest pain, shortness of breath, or swelling that worsens. These may require urgent medical attention. Lifestyle changes after surgery. Heart bypass surgery fixes the immediate problem of blocked arteries, but it does not prevent new blockages from forming in the future. That's why lifestyle changes are a crucial part of long-term heart health after surgery. Patients are advised to quit smoking completely, as it significantly increases the risk of heart disease recurrence. A balanced diet low in saturated fats, salt, and added sugars is recommended to keep cholesterol and blood pressure under control. Regular physical activity, such as brisk walking, swimming, or cycling, helps strengthen the heart and improve overall health. Managing stress through meditation, yoga, or hobbies can also make a big difference. For patients with diabetes or high blood pressure, regular monitoring and proper medication use are essential. Joining a cardiac rehabilitation program where professionals guide exercise, nutrition, and stress management can boost recovery and help patients stay motivated. These lifestyle changes not only protect the new bypass grafts, but also prevent further damage to other arteries, improving quality of life and reducing the risk of another surgery. Long-term outlook. The long-term success of heart bypass surgery depends on both the quality of the surgery and the patient's commitment to a healthy lifestyle afterward. Most patients experience significant relief from chest pain, improved physical activity tolerance, and a lower risk of heart attack. Studies show that bypass grafts can last 10 to 15 years or even longer if properly cared for. However, grafts made from veins tend to have a shorter lifespan compared to those made from arteries. Regular follow-up visits with a cardiologist are important to monitor heart function and check for any signs of new blockages. Diagnostic tests such as stress tests, echocardiograms, or angiograms may be performed periodically. If lifestyle habits are neglected, cholesterol levels rise, or smoking resumes, new blockages can occur, reducing the benefits of surgery. With good self-care and medical monitoring, many patients live active, fulfilling lives for decades after bypass surgery. The key is to treat the surgery as a starting point for long-term heart health, not a permanent cure without effort. Conclusion. Heart bypass surgery is a life-saving procedure for people with severe coronary artery disease, offering relief from symptoms, improved heart function, and a better quality of life. While it is a major operation with risks, its benefits are well documented, especially when combined with lasting lifestyle changes. The journey involves more than just the hours spent in the operating room. Preparation, hospital recovery, home care, and lifelong health management all play vital roles. Advances in surgical techniques and post-operative care have made bypass surgery safer and more effective than ever before. However, success largely depends on the patient's commitment to healthy living after the procedure. By quitting smoking, eating a heart-friendly diet, staying active, and managing stress, patients can maximize the lifespan of their grafts and enjoy many years of good health. In the end, heart bypass surgery should be seen not just as a repair, but as a second chance to build a healthier, more active life.